And so for many, that's how it's revealed.
Okay, is by ultrasound. And I would agree. There's very, specific characteristics on an ultrasound. I've looked at lots of thyroid ultrasounds. I actually do biopsies, and so you can usually tell by the ultrasound. Correct? Maybe not all radiologists. I feel like radiology has kind of moved to this, like, you know, just whoever looks at thyroid ultrasounds. But if you're a trained endocrinologist or somebody who looks at a lot of thyroid ultrasounds, you know what Hashimoto's looks like on an ultrasound.
Mm-hmm.
Sometimes I feel like that gets missed in general. Like if you get a thyroid ultrasound and you have just somebody reading it, a lot of times they'll say, "Oh, the thyroid's enlarged, no nodules," but that's it.
Well,
So
and the important point you bring up too is that Hashimoto, as I mentioned before, you want to separate it from hypothyroidism. There's strong evidence that the immune changes from Hashimoto's can cause all these classic hypothyroid symptoms, the weight gain, the fatigue, the hair loss. They can also cause things like fluid retention, anxiety. And there's massive data sets saying that it can also cause medical risks, heart disease, infertility, autism in babies, certain cancers. And it does these things no matter where the actual thyroid levels are. And sadly, many doctors don't get that distinction. They think that they have to manipulate or correct thyroid levels to help people. And meanwhile, they may be totally symptomatic from the autoimmune side. And in the conventional, they don't even look at that. So that's the big difficulty.
yeah, and I see this all the time to people. Like I look at people as a whole, holistically, and I think that most of disease starts with inflammation, and a lot of our inflammation, unfortunately, in this country comes from our gut.